Hi, I'm Dr. Mark Salzberg, and tonight we'll be talking about oncology and new things going on in the world of veterinary medicine. So stay tuned to Pet Owners Hotline. Salzberg. Tonight we have a guest from Affiliated Veterinary Specialist, which is specialized in the areas of oncology, radiology, neurology, and other advances in veterinary medicine. Dr. David Lurie is with us, and he'll be talking about radiation and medical oncology. Welcome to the show, David, and tell us a little bit about Affiliated Veterinary Specialists just in general first.
Yeah, thanks, Mark. Well, basically, Affiliated Vet Specialists is currently the only multidisciplinary specialty hospital in Central Florida. And as you mentioned, it covers a wide range of specialty services for specialized pet care, including things like radiology, oncology, surgery, internal medicine, dentistry, and neurology. And we foster a pretty collegiate approach to care of individualized patients where, you know, the big advantage is that we can all bounce ideas off one another. We all come from pretty diverse training backgrounds, and I think that's a strong point of what we can offer, as well as some pretty specialized equipment for advanced diagnostics and specialty treatment techniques that are not readily available at the family veterinarian.
So tell me, I know you have a big staff there. Approximately how many techs do you have there?
Right. Well, we just in the doctor side, we have about 5 internal medicine specialists, 5 surgeons, 2 neurologists, a radiologist, oncologist, and our technician to doctor ratio is very good. Certainly compared to clinics I've worked at in the past, we have great technical staff. I'd say we probably have a ratio of 2 techs per doctor. One of the other nice things about this clinic is we also partake actively in training programs. We have a residency and internship program for veterinarians coming out of vet school that want to advance their careers in certain disciplines. And that keeps us on our toes and allows us to keep a foot in the research arena as well. I still have active ties to the University of Florida, where I was for many years as well. So that's another aspect of the specialty medicine that gives back a little bit, I guess, to the community in a broader sense.
That's excellent. And so when you say specialty, so all of these doctors at this clinic all have advanced training, so they all have residencies, fellowships, all those sorts of things. Is that correct?
That is correct, yeah. And typically it will mirror quite closely what happens in the human specialty arena. So out of your training program, veterinary training program, you'll go into a 1-year internship and then typically a 3-year residency training program thereafter.
Good, good. So how long have you been doing oncology, both medical and radiation oncology?
Yeah. It's been about 14 years now, pretty much the length of time I've been in the United States. I came out to do my internship at the University of Illinois, where I was involved in an oncology internship. Went through 2 residencies, medical and radiation oncology residencies in California, and then I've been in academic and private practice since then.
So you were at you told me you were at University of Florida, and you kind of kicked off their, I guess, radiation oncology program, right? Or both?
Actually, the medical oncology program, and then leading into the radiation, that's been a more recent addition. But yes, I was one of the founding members of their oncology program.
Yeah, phenomenal. And so how long have you been at Affiliated Veterinary Specialists now?
On a full-time basis, I've been there now probably 14, 15 months, but I was commuting on a weekly basis for a period of about 4 years from practice I was working at down in Miami. So I've had a long-standing relationship with them and a great group of people to work with.
Oh, cool, good. If you know, just kind of before we get started, there's a couple things I think we should tell everybody. The affiliated veterinary specialist is a specialty group, and in general requires referrals from local veterinarians who have situations like that. I know that they can get in touch with you, but so we're going to talk about some specifics, and they can also call you directly as well. And just wanted to tell everybody out there that you can join us tonight if you'd like to ask a question. We'd be honored to answer it if you just give us a call at 1-800-901-9238. We'll try to do the best we can to answer any questions you might have. So let's get to talk about more specifically what you do there.
Right. Well, as you introduced me to the guests, I'm an oncologist, and with training both in medical and radiation disciplines. So just to differentiate what that is, the medical oncology is chemotherapy. And radiation, of course, is the use of radiation from a linear accelerator to treat various types of cancers. What I can say about cancer care, whether it's a person or an animal, is generally it's multimodality approach. It's very rare that one or other treatment is going to encompass the entire management of a patient case. So we'll integrate chemotherapy with radiation, with perhaps immunotherapy. Just like in people, the veterinary oncology discipline is probably the most rapidly expanding in the veterinary field in terms of research being done and treatments coming to the fore. And it's been an interesting experience for me over the last 10 years, talking and interacting with clients. I think as they've become more aware of cancer in their own lives, family, friends, and being aware of what treatments are available to them, and because the animal-human bond has developed over the years to where pets are now considered part of the family, they often expect the same standard of care. And we are getting to a point where we can now offer some of these advanced treatments. So, radiation is one of the things I do on a daily basis. It's a very costly discipline to set up in any kind of practice, mostly because of the room design. That's an interesting fact, that to shield and protect the co-workers, it requires a very advanced architectural bunker design that can be very costly to set up, apart from just the equipment itself. And that's why it's not readily available. There are not many places in the state.
There aren't many places in the state that do radiation.
That's right. And I have clients coming from all over the state, and sometimes even out of the state for care. So we have to provide boarding facilities for some pets, and some people will even come and stay in pet-friendly motels and hotels while their animals are being treated. So we try to accommodate as best we can.
So I'd kind of like to start off telling me, just sort of in general, what are some of the most common cancers that we deal with in veterinary medicine? Yeah. And I have in my mind sort of the ones that I see the most, but you obviously see pretty much all of them. So.
Sure, yeah. Well, we see a wide variety, and probably the prime candidates in terms of frequency is lymphoma. Canine lymphoma and feline lymphoma are very common in the pet population. We see a lot of brain tumors. That's where I work closely with the neurology group. Often they're diagnosed through a different service before they come to see me because of the symptoms they present with. I see a lot of skin tumors, melanomas, similar presentations in some cases to people. It is a different disease than what people get, but we do see it a lot. Head and neck tumors, oral cancers, things like that, are all daily sort of patients in my practice.
And most of these tumors that you're talking about, I think that some of the things that people kind of notice about their animals that are different, and what are sort of some of the hallmark things that you would tell people to kind of pay attention to?
Sure, yeah. There are several sort of hallmarks to watch out for. Cancer can really affect any part of the body, so there is a wide variety of symptoms, but some of the more common ones are, not eating, becoming more withdrawn or lethargic, maybe vomiting, diarrhea, bleeding from the nose. Any lump or bump, you know, that's a fairly easy one to pick up on, especially those that are rapidly growing. You know, some of the ones that have been there over long periods of time tend to be more benign, but if they are rapidly growing, that's generally a cause for concern. But anything from seizures to urinary obstructions, you know, problems defecating, all of those could potentially be on a differential list for a cancer.
And so, tell me a little about let's start with medical oncology. What, you know, obviously there's a wide variety of treatments depending on what sorts of cancers you're treating, but what sort of a typical I want to say visit rate or protocol that you would have for most people, just to have in their ideas, you know, excuse me, in their mind,
sure.
Sorry, how often they're going to have to come, that kind
sure.
of stuff.
Sure, I think probably important to let the viewers know that there are always more than one potential direction a client with their pet could follow. We have, you know, the A plan and then anything from B and C plan that can all be effective therapies. But, you know, anywhere from a weekly visit for up to 6 months to, you know, once a week or once every 3 weeks, you know, type treatments in terms of the chemotherapy aspects. Initially, it tends to be a little bit more heavy because we're trying to induce remissions. Once a patient is in remission, we can start to tap back a little bit and do more of a maintenance regimen. On the radiation front, most of the protocols actually call for daily treatments over the course of a month or so. So it really does vary depending on the tumor type and what logistical, you know, hurdles a client may have, and then of course how the pet is tolerating everything.
And I know from my own experiences that it seems that animals tend to tolerate these things a lot better than I think than people think, because their mind is set on what did my grandmother do, or what did my brother do, or whatever.
Yeah.
Is that true?
Yeah, that's a very common question I get in my practice is how's my pet going to do, because they come in with all these nightmare scenarios in their heads. And I think the big thing to differentiate here is we are very focused on quality of life. You know, we're making decisions for these pets where they don't really have any input. They can't tell us what they want, so we are mindful of that and bring it to the fore. And our protocols are designed, you know, with that in mind. So we tend not to see very significant side effects. There are always instances where that can happen, and I always do counsel clients. Things can happen that are unexpected, but for the most part, any side effects that they do experience are mild to self-limiting, may need a little bit of supportive care in the hospital 1 or 2 days, but you know, I think if I had to poll my clientele, probably 98% of them would do it again if they had to.
Yeah, I noticed. I mean, I had to subject my own dog to chemo for lymphoma. Actually kind of weird because it was this very young dog, 3 years old, with intestinal lymphoma. But he did great, and we're a year and change post treatment, and so far so good. So very fortunate. And he never experienced. And I think a lot of people have in their mind that, are they going to lose all their hair? Are they going to just be nauseous all the time? And that doesn't tend to happen, right?
No, it doesn't tend to happen. There are certain breeds where hair loss can occur, but you know, for the most part, the dog hair growth is different to people, and they don't tend to lose their hair. Cats can lose their whiskers. That's an interesting thing, but they do grow back. And you know, a lot of times when they do lose their hair, it'll grow back with a lusher coat, usually changing some coloration. But it's you know, most clients like that. You know, they look different but fun.
That's interesting. I didn't think about cats' whiskers.
Yeah.
Because a lot of dogs, their hair grows to a certain length and then stops. They go into this, kind of that growth phase stops, and so they don't typically lose their hair. But I didn't think about whiskers that continue to grow. We're actually going to go to the phones. Go ahead, caller. You're on the air. Kim?
Yes, hello.
Hey, how are you today?
I'm doing wonderful. How are you guys?
Good. What's your question for us?
Yeah, I have a 8-year-old Boston Terrier mix who was diagnosed with pancreatitis, and she'd become very ill if she ate anything outside of her diet that we have now, which is Hill Science Diet WD,
Right?
which we notice is mostly corn, and she's real sensitive to trying other things. She'll get very ill and, pass blood. So what other kinds of more protein-based dog food should I try, and should I be worried about, blows or a bad pancreatitis bout, because I almost lost her on a pancreatitis bout.
Okay, it's a good question. Not specifically pancreatic cancer, although I do know that dogs do get pancreatic cancers.
Yeah.
The answer to that question is this, and it's a simple one. You really should follow the instructions of your veterinarian on those cases. There are several foods that we use. WD is certainly one of them. Their ID is another one. Those diets are kind of made to, in a fashion to try and prevent the inflammation to recur. Are they a guarantee that if you only fed that diet that you would never have it again? I would say probably not. But that's, the bottom line is that diet may play a part in preventing it from recurring. I don't know that, and you may know this, but has anybody ever really proved that diet is the cause, or dietary indiscretions are the cause for pancreatitis in dogs?
Well, I think that to my knowledge, as you said, it's not my specialty, but fatty diets obviously are one that are implicated a lot of the time, and there tend to be a flare-up around holidays. You may see this in your practice,
sure.
Where pets are getting the table scraps, things that are rich in fats and such. So I would stay away from those kinds of events, feeding high fatty foods and table scraps. And the last thing you want is a chronic pancreatitis that keeps flaring up. That'd be a big problem.
Yeah, because dogs can form like pancreatic abscesses,
yeah.
and I've actually had one dog who did actually develop pancreatic cancer, which is kind of a weird thing, but unfortunately was diagnosed later. But tough thing. So good question. But most of the time with those things, you just follow your recommendations for your veterinarian, and like Dr. Lurie said, you just stay away from from especially fatty foods like table scraps, stuff like that. So radiation oncology. Now, I guess my ideas of radiation is some of the stuff that I'd seen with basically sort of whole areas being irradiated. That's not true anymore, right?
For the most part, not. No, it's more targeted, and as the equipment has become more sophisticated and we've gained wider access to a lot of the human planning systems on a more cost-effective basis, we can now do the same deliveries. We can really focus down and pinpoint the abnormal cells. There's always going to be some collateral tissue exposure, and there are tissue bounds that we don't want to exceed. And we have that pretty well worked out as a specialty group now. We know, for the most part, the doses we can administer to certain parts of the body. But there are indications for what's known as wide field radiation, or larger swaths of the body being treated. Lymphoma is a disease where we tend to do that sometimes because it is a systemic illness. There are programs that are running bone marrow transplant programs, for example, where we want to do a bone marrow ablation to give back a stem cell to a patient, where we would use wide field radiation to do that. But those are specific instances. Mostly now it's pretty targeted and very specific.
How about success rates? I mean, I know you can't, again, specify, but how of the different cancers, which ones are we having the most success treating? Right.
With radiation, a lot of the skin and subcutaneous tumors we have great success with, things like mast cell tumors and various soft tissue sarcomas. Those are probably the most common tumors we'll see and treat with radiation. They tend to be in instances where surgery is done, but we haven't achieved a clean or wide surgical margin, and we're down to a microscopic disease scenario that is well treated with radiation. We can mop up, so to speak, those outlying cells, and we have a very successful outcome in most of those patients. I mentioned brain tumors earlier, and that's one we do treat a lot with radiation because generally surgery is not a viable option because of the location. And in those instances, we get some pretty good long-term control, not necessarily cures, but I have patients that can, you know, go 2 to 4 years in many instances with tumors that, when they come in, are causing, you know, onset of seizures, mental dullness, things of that nature. So we can get some really good outcomes with radiation.
That's very cool. And when you irradiate a brain, I mean,
yeah.
You don't want to get a whole lot of collateral damage there, right?
No, exactly right. We want to definitely minimize, you know, the amount of nervous tissue that is exposed, and that's where the planning software comes into play. There are collimation devices on these machines now that allow us to shape the beam more specifically to the tumor contour, and then with quality control techniques, the setup in the vault itself where the machine is housed, there's a lot of, it looks like a Star Wars thing sometimes, you know, there's laser pointing beams and all things going on that help us to localize the tumor volume and repeatedly target that volume on a day-to-day basis.
And I know lymphomas tend to have a fairly good outcome for treatment. And
yeah.
I think I'd kind of like people to know that, you know, I think that till not so very long ago, a lot of these cancers, we just thought, you know, this is all, you know, just, you know, kind of planned, keep them as comfortable as possible.
Yeah.
You know, historically, lymphomas were treated often, even on local veterinarians' levels. I mean, I can remember 20 years ago treating a lot of lymphoma patients myself, just because there was we didn't have anybody like you around. We had, you know, kind of had to do it. So.
Right.
And those were pretty successfully treated, generally speaking. Is that true?
Yeah,
Even more so, probably.
Absolutely. I mean, there still are some limits, you know, largely because of, again, our philosophy of quality of life. It's interesting, I was just at a meeting not too long ago up in North Carolina. It's an annual Veterinary Cancer Society meeting where we get together and knock around some ideas, present research and such. And one of the things that came up in discussion was dose escalation. Because we have, at this point, to a large extent, reached the limits of our success rate with conventional chemotherapies without pushing the envelope on the dose side. But with that would come more toxicity. So it's always a balancing act, and a lot of counseling goes into making these decisions. You know, different clients have different tolerance levels of what they want to go through. But as a patient advocate, you know, I'm very cautious about not tipping it too hard on the quality of life side to the negative. So we do get great results with lymphoma. It's a tumor that is very chemosensitive and radiation sensitive, and we have protocols that are very well established, have been in use for many decades, so we have a lot of comfort levels. But there are always, you know, outlying events that can happen, but for the most part very successful with years of survival.
That's great.
Yeah.
I mean, again, it's not, you know, we've seen successes, and certainly, like you say, you know, unfortunately, there are no guarantees in this life when you're talking about it.
Right.
You know, a biological beast and these things that happen. But just kind of a reminder, everybody, that Affiliated Veterinary Specialist is in Maitland, and you can call them directly. This is their number, 407-644-1287. However, in most cases, you would ask your veterinarian if there was something going on that was beyond their ability. They would most likely, at least in this area, refer you to talk to Dr. Lurie or all of the other veterinarians there that are all, like you said, specialists in a whole vast array of areas. So,
yeah.
So tell me, mast cell tumors, another fairly common tumor that we see in veterinary practice. You know, often we get the diagnosis after we've surgically removed it, and then, you know, kind of we're left with, okay, what do you do now?
Yeah.
And
it's a great question. You know, we refer to it as the great imitator tumor. You know, it can look like literally anything. That's the first thing, and you know, sometimes, you know, we tend to think of a certain shape or size or location of tumor, and we key in and this is what it is. But mast cell tumors are one that can take on varying shapes and appearances. So ultimately, any lump or bump, you know, should be checked out with a regular veterinarian, a simple aspirate, for example, to make a diagnosis. But once that's made, this tumor in particular has a lot of treatment options. It tends to center specifically on surgical extirpation first, And then depending on margins and grade of the tumor, we would then talk about other adjuvant therapies. So if it was a high-grade tumor, that's where chemotherapy comes into the discussion. If it was incompletely excised and it's in a location where we can't take more tissue, so for example, the lower part of the limb where there's not a lot of skin, and we don't want to cause a functional gait impairment, then radiation may come into play. So it really does depend on what the biopsy is telling us after surgical excision.
Good. And then, again, other things like melanomas. I know that a lot of people see dark pigmented masses on their dogs and are sure they're melanomas because that's what it would be in a human, and many of them aren't. But, so melanomas now, are those treated surgically and then?
Yes, you know, we see a couple different varieties of melanomas in dogs. Certainly the dermal or skin melanoma form, which actually in dogs is relatively benign disease. It doesn't mimic the people experience, but we see them in the mouth and also in the toes, and they are much more aggressive in those locations.
I'm sorry, I got you talking about that, and then we were out of time. If you were not able to get your question answered, please email me at wdsc@daytonastate.edu. I want to thank my guest, Dr. David Lurie, for coming to talk to us about affiliated veterinary specialists. I'm racing through this, radiation and medical oncology. I hope that you enjoyed the show, and you will join me next week for another episode of Pet Owners Hotline. I just asked you that. We had tones. Oh, no.